Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Today we will be studying an important topic of urticaria, also called as the hives. Okay, so if I talk about the definition, so urticaria are transient, pruritic and edematous wheal due to the plasma leakage from your dilated venule. See, these are the figures. So what we have read that they are transient, they are pruritic and they are edematous wheals. If I talk about the epidemiology, so they basically affects 20% of the people at least once. Any age can be affected and it is more common in young adults, okay. If I talk about the classification, then the classification is usual. You have the acute one and then you have the chronic one. Acute one is if it is less than 6 weeks and chronic one if it is more than 6 weeks. Immunological and non-immunological, idiopathic and physical. These are basically the classification that you have. In the physical urticaria, there is cold, there is cholinergic involves, pressure will be there, solar and acugenic. What is the pathogenesis behind it? Firstly, there will be degranulation of mast cells and basophils. After the activation of mast cells, what I have told you, you have to remember that there is histamine which is triggered, and after the histamine is triggered, there is vasodilation, edema and itching, right? If I talk about the morphology, I have taught you this way. I have this picture is of urticaria, okay. So in the morphology, there is wheal which is centralized edema plus erythema, lasts for less than 24 hours and it is extremely pruritic. There will be angioedema and deeper swelling will be there. What is the etiology? It is allergic. Like the foods, what are the foods? You will be having nuts, shellfish, just like the word. Eggs and strawberries. Drugs are penicillin, sulfa and NSAIDs. These are basically the triggers that you have. What are the infectious etiology? There will be viral infections like hepatitis, 𝗵𝗵𝗵𝗵 virus, COVID-19, bacterial virus like the streptococcus and H. pylori. And in parasitic, you have something called as a giardia, and giardia have a motility called as the falling leaf motility. That you need, that I guess you have read that in your microbiology, right? What are the other etiology? It can be autoimmune like SLE, thyroid disease, and physical stimuli can be there. What are the clinical features? There will be itching, there will be burning, and there will be swelling that will be present. Angioedema can be appreciated in lips, eyelids, and tongue. See, if it is in lips, and these are your normal lips, these are your normal lips. If the person is having angioedema, the lips will be swelled up. Edema means what? Edema means swelled up, right? The differential diagnosis is urticaria vasculitis, erythema multiforme, and drug rash contact dermatitis. What are the investigations? Investigation is CBC, ESR, thyroid antibody, and allergy testing, because you need to see that the person is having any sort of allergy or not, right? What is the treatment? Avoid the triggers. If the food is having the trigger, after consuming the food you are having that disease, just avoid that. If after consuming certain amount of drug, if after consuming the drug you are having the disease, then just avoid that. Avoid NSAIDs, avoid alcohol and tight clothing. Okay, what is the treatment? The first line is non-sedating H1 blockers like cetirizine and updosing if possible. Treatment for add-on, you have H2 blockers. For severe, short courses steroids, and refractory is omalizumab, that you will read very well in your pharmacology. I don't have to teach you in this much of details, right? For the emergency medicine, you have to give epinephrine, IM, okay? 0.3 to 0.5 mg. Maintain the airway, give oxygen to the patient, IV fluids and antihistamines, right? What are the complications? There will be either there can be airway obstruction. Why there is a airway obstruction? Because if the foreign body is getting obstructed in that person's passage, there will be obstruction, right? Then there can be the chronic urticaria. What is the prognosis? See, if it is acute, it resolves in days to week. If it is chronic, it takes more than 50%, resolves in 1 year. These are your high yields, your summary, that if the lesion is more than 24 hours, it will lead to vasculitis. Most common is acute. Causes are food and drugs. Then you have the chronic causes like idiopathic and autoimmune. Drug of choice is H1 blockers, and in refractory we give the 𝗲𝗵𝗵𝗵. We are done with this chapter. If you are having any sort of doubt, please feel free to reach me. Please feel free to DM me. Thank you so much.